Circulation of the blood. When the blood leaves the heart, it travels through the body through several types of blood vessels. Blood vessels are described by their function, location, and whether they carry blood away from or to the heart. The kind of vessel that carries blood away from the heart is called an artery. There are several arteries that are important to know. Coronary arteries. The coronary arteries, in figure 6-9, branch off from the aorta and supply the heart muscles with blood. Although the heart has blood constantly moving through it, it receives its own blood supply from the coronary arteries. Damage, severe narrowing, or blockage to these arteries usually results in chest pain. Aorta. The aorta is the largest artery in the body. It begins at its attachment to the left ventricle, travels superiorly, then arches inferiorly in front of the spine through the thoracic and abdominal cavities. At the level of the navel, it splits into the iliac arteries. Pulmonary artery. The pulmonary artery begins at the right ventricle. It carries oxygen-poor blood to the lungs. You may notice that this is an exception to the rule that arteries carry oxygen-rich blood and veins carry oxygen-poor blood. It does, however, follow the rule that arteries carry blood away from the heart, while veins carry blood to the heart. Carotid artery. The carotid artery is the major artery of the neck. You will be familiar with this vessel from your CPR class. It is the artery that is palpated during CPR pulse checks for adults and children. It carries the main supply of blood for the head. There is a carotid artery on each side of the neck. Never palpate both at the same time because of the danger of interrupting the supply of blood to the brain. Femoral artery. The femoral artery is the major artery of the thigh. You can relate the name femoral to the bone in the thigh, the femur. Pulsations for this artery can be felt in the crease between the abdomen and the groin. This artery is the major source of blood supply to the thigh and leg. Brachial artery. The brachial artery is the upper arm is the pulse checked during infant CPR. Its pulse can be felt anteriorly in the crease over the elbow and along the medial aspect of the upper arm. It is also the artery that is used when determining blood pressure with a blood pressure cuff and a stethoscope. Radial artery. This artery travels through and supplies the lower arm. The radial artery is the artery felt when taking a pulse at the thumb side of the wrist. Again, you can relate the name radial to the radius, a bone in the forearm that the radial artery is near. Posterior tibial artery. This artery is often used when determining the circulatory status of the lower extremity. The posterior tibial artery may be palpated on the posterior aspect of the medial malleolus. Dorsalis pedis artery. The dorsalis pedis artery lies on the top, the dorsal portion, of the foot, lateral to the large tendon of the big toe. Arteries begin with large vessels like the aorta. They gradually branch into smaller and smaller vessels. The smallest branch of an artery is called an arteriole. These small vessels lead to the capillaries. Capillaries are tiny blood vessels found throughout the body. As explained earlier, the capillaries are where gases, nutrients, and waste products are exchanged between the body's cells and the bloodstream. From the capillaries, the blood begins its return journey to the heart by entering the smallest veins. One of these small veins is called a venule. See figure 610. The kind of vessel that carries the blood from the capillaries back to the heart is called a vein. Remember that the blood flow from the heart started in the largest arteries and moved into smaller and smaller arteries until it reached the capillaries. The blood takes an opposite course through the veins. The blood travels from the smaller to the larger vessels on its return trip to the heart. Immediately after leaving the capillaries, the blood enters venules, the smallest veins. From the venules, the veins gradually get larger, eventually reaching the vena cava. There are two vena cavae. Venae cavae. The superior vena cava collects blood that is returned from the head and upper body. The inferior vena cava collects blood from the portions of the body below the heart. The superior and inferior venae cavae meet to return the blood to the right atrium, where the process of circulation begins again. Okay, note the difference between vena cava and venae cavae. So it's just adding an E to the end of each of those words, but it makes it plural. So vena cava is one, singular, and when it's plural, it adds an N to the end, but you pronounce it venae cavae. The pulmonary vein carries oxygenated blood from the lungs to the left atrium of the heart. This is an exception to the rule that veins carry oxygen-poor blood. However, it does not follow the rule that arteries carry blood away from the heart while veins return blood to the heart. Okay, let's review some of these terms. Aorta, the largest artery in the body. It transports blood from the left ventricle to begin systemic circulation. Pulmonary arteries, the vessels that carry deoxygenated blood from the right ventricle of the heart to the lungs. Carotid arteries, the large neck arteries, one on each side of the neck, that carry blood from the heart to the head. Femoral artery, the major artery supplying the leg. Brachial artery, artery of the upper arm, the site of the pulse check during infant CPR. Radial artery, artery of the lower arm, the artery felt when taking the pulse at the thumb side of the wrist. Posterior tibial artery, artery supplying the foot behind the medial ankle. Dorsalis pedis artery, artery supplying the foot, lateral to the large tendon of the big toe. Arteriole, the smallest kind of artery. Capillary, a thin-walled, microscopic blood vessel where the oxygen, carbon dioxide, and nutrient/waste exchange with the body's cells takes place. Venule, the smallest kind of vein. Vein, any blood vessel returning blood to the heart. Let's look also at this figure 6-9, the coronary arteries. Base, superior. Right coronary artery. Left coronary artery. Anterior descending branch. Apex, inferior. Okay, let's also review this figure 610, arteries, capillaries, and veins. Vein, valve, venules, artery, arterioles, capillary bed. From the heart, oxygen-rich blood is carried out into the body by arteries. The arteries gradually branch into smaller arteries called arterioles. The arterioles gradually branch into tiny vessels called capillaries. In the capillaries, the blood gives up oxygen and nutrients, which move through the thin walls of the capillaries into the body's cells. At the same time, carbon dioxide and other wastes move in the opposite direction, from the cells and through the capillary walls to be picked up by the blood. On its return journey to the heart, the oxygen-poor blood, now carrying carbon dioxide and other wastes, flows from the capillaries into small veins, called venules, which gradually merge into larger veins. So, following the diagram this way. Coming from the heart, returning to the heart.